doctor's saying, give me a temporary pacemaker, give me a temporary pacemaker. The thing that we have to remember is that what if we only had arterial access? Radial, femoral, whatever. We don't have venous. This has to go in the vein, right? This is going into the right ventricle. So they have to pass us off our supplies. The very first thing we need is another sheath. Okay, so we're going to have to get our arterial needle. Get that up here for the doctor. Get a wire, which if I had a shorty wire, I would just use a shorty wire. I'm not sure where my shorty wire was on here, but I'll use the 150 wire. We're going to get a wire up here. And we're going to have our sheath. Okay, we're going to need to get our sheath prepped. While we're getting the sheath prepped, the doctor's getting venous access. Okay, so I'm ready to go with my venous sheath. Getting venous access, I'll go through that in a minute. So then we need our pacemaker supplies. So depending on what pacemaker the doctor calls for. So the pacemaker, this is one example, okay, of just a plain pacemaker. I believe this one is 6 French. So it's going to come in a little kit. Now, I don't have the exact kit that one came out of. This is just a little example of one of the kits. This is actually a whole tray. This one, they usually put them jugular. This is like a 5 French balloon-tipped temporary pacemaker. It comes with a sheath, it comes with a cover, you know, access needle and things like that. But these are just going to come very similar, packaged as your Swan-Ganz catheter. Comes in that kind of hard shell case. It's going to come with some little adapters. There is going to be a covering over the tip, and you're just going to pull that covering off. This does not have a lumen, so you don't flush it. If you want, you can do a quick dip in your flush bowl and get ready to put it in. You also are going to need, first let's look at this. This is a balloon-tipped Swan. Some doctors may want to use it, okay? If they do want to use it, it would come very similar to your Swan-Ganz. The only port is your balloon port. So you're going to pull in however much air. It's going to be just like a Swan-Ganz. Stick it on. Test your balloon. This one's popped. You would test it under the water real quick. Pull the air back out. Maybe when we tested it, you know, we're just giving it a quick dip. It's ready to go into the patient. Okay? Now this one has adapters that are a little bit different. And actually these adapters come on already. So I just pulled it off, but I don't want to take a lot of time, so I'm not going to worry about that. These adapters are little pin push adapters. You're just going to push in, and this is going to fit into our cable. We're also going to need this cable. This cable is what extends our working length on our pacemaker, and this part gets passed off to the circulator. This is what gets plugged into the little generator. Okay? So once we got all this passed off, I would go ahead and pass that off. They would plug that into the generator. Of course, I'm going to keep this part here for me. I'm not going to plug in until we've got it down in the ventricle, but I'm going to show you that step in just a second. One last thing I want to show you. So Adam, turn that around. This is a sleeve, okay? They come packaged separately. If we can at all get this on, we want to put it on. Because if we need to leave this in the patient, this is a sterile sleeve, okay? When it comes out of the package, it looks like this, okay? And so it's a lot easier to put on than this. Now, if you guys have practiced with this any, I want you to practice with this because I don't have a lot to show you an example. As soon as you pull this apart, it never goes back like this. But once we've got it in the body, this is what we want to do. That way, if we need to push it in some, pull it out some, it stays sterile. That catheter stays sterile. So it's called a sterile sleeve. Okay? So this is the process. I've already demonstrated just a little bit. I've got all that ready. So doctor's up here getting access. just like doing a right heart cath. Wire in. Out. You're helping the doctor. Put the sheath in.
Is it 6 French?
Depends on what they call for. There are 5 French, but a lot of people do use a 6 French temporary pacer, but there are 5s, so it depends. Okay, sheath is in. Wire and dilator come out. Of course, you want to get rid of your shark. Next step. So while, if I could have been getting ready, I would have put my sleeve on. The thing about the sleeve is you do have to put it on the correct end. All right, so there's one end that goes to the back end of the temporary pacer and then one end that goes to the sheath. And I'll show you how that looks in just a second. That's going to be your squishy end. Your squishy end is the one that you want to go connect to the sheath. So when you are putting this on, you do have to put it on correctly. And so you're going to put it, the hard end back here. And of course, this one I'm having to, got stretched out, but I want you to be able to see it, okay? And I would take, and obviously when we first start with it, it's gonna be like this. So it's a lot easier to put on, and you're just gonna take and push it all the way to the back. You're gonna give this to the doctor. The doctor's gonna take it, just like the Swan Gans, put it in, it's going up the IVC, going through the right atrium, and really there's not a lot you gotta do at this point. Probably what I would be doing is making sure if I didn't already have my little pins in, put my pins in, pass off that piece to my circulator if I hadn't already done that, okay? All right, now doctor has got it in the right ventricle and is ready for me to connect. The only thing you gotta remember with this is positive to positive, negative to negative, okay? It's got a positive sign and a negative sign. Red is always positive, black is negative. Now, if it's not color-coded though, it tells you it has the symbols. You do have to come here and find which is your positive and which is your negative. Now, on this one, it says distal negative. Says nothing about positive. But obviously, if this is negative, this is positive. That's as simple as it gets, folks. Okay, so negative goes in to the negative, positive goes in to the positive. They've plugged into the box. They've set the parameters, your MA, your heart rate, your demand or your demand mode or your mode, and turn it on. So for the scrub tech, that's as simple as it gets. I mean, it's pretty simple. Now, at the end, if we are going to leave this in, this is where we do want to open our sleeve up, and we want to come and just put the plastic piece to secure there. And this is, a lot of times they will have you suture this in. So they'll have you suture the sheath. Now, this reminded me, so when you were asking me about wrapping that tubing, we don't normally do that on the pericardiocentesis because it's not that long, but this is a little bit longer. So a lot of times what we will do is we'll put some 4x4s and we will wrap and then put Tegaderm on top of that to secure it. This again is if we're taking the patient to the room with it in, okay? And of course, once we're done with the procedure, any of that part that's not sterile, we're just gonna lay it up on the patient's body along with the box. Now say we put this in prophylactically, or even we put it in emergent, but we got the patient stable. The doctor's like, okay, let's check and see if they still need this pacemaker. We turn it off. They don't need it. All right, well, we had the sleeve on, but we don't need to leave it. So, I just don't mess the sleeve up. It would just still be back here. All we're gonna do to remove the pacemaker, pull it straight out, leaving the sheath in. If the patient's anticoagulated, then we have to deal with the venous sheath the same way we'd be dealing with the arterial sheath. Leave it in till ACT gets down, secure it, blah, blah, blah. If it was a diagnostic procedure that this happened in, or some reason that we're going to be able to remove the sheath, then that's when we do our venous hold, pull, hold below, compress, 5 to 7 minutes, and we're hemostasis on our vein. But I do want you just to be able to remember that, of course, when we first pull, if they say, okay, we can just pull the pacemaker out, like the doctor's like, okay, he leaves the table and says, okay, we don't need to leave the temporary pacer in, we can pull it out. Don't pull the sheath at that moment, especially if it was an intervention, they've been anticoagulated. Just pull, just like we were pulling a catheter out of the patient. Okay? But pretty simple. I think any of you can do this with not much trouble. I think the biggest thing you might forget is the sleeve, getting that sleeve on. I've forgotten it before myself. The bad thing is if you do forget it, and they're dependent, the doc's not going to pull it out and then have you put it back in. So you would have to, of course, secure it with no sleeve. And then if we had to reposition, we could possibly, take a chance of contamination. So even if I'm putting it in prophylactic, it's the same process, just slower. We're not like, we got to get this patient saved. But I still like to put the sleeve in, because even if it's prophylactic, what if we do something while we're doing the intervention that makes them pacemaker dependent for a little while? Then we have our sleeve already on it. So just kind of try to think about, usually everybody keeps all of their pacemaker supplies together in one spot. That's, again, I'm going to just remind you, when you get out there in clinic, you want to learn where all the emergency supplies are. Look at the crash cart when you have downtime. These are the things that are going to help you to be better. And of course, once you get your job, if you don't get your job at one of the places where you are interning, once you get your job, you need to make sure you're very aware how to use the defibrillator, whatever kind they've got, because it may be different. What's all in the crash cart? Where's the crash cart? Where's your pacer supplies? How to use that pacemaker generator. All those kind of emergency things that you may not have time to really think too much about. You need to know where they are and how to use them. Okay? Mm-hmm. Okay. So that's it for today.